Hello, welcome to my channel. My name is Nurse Pauline RN. Thanks for watching today. I will be uploading videos on Tuesdays and Thursdays at 10 a.m. Eastern Central Time. Today we are going to be focusing on Chapter 2 in Fundamentals of Nursing. The goal of my video is to assist nursing students with all the answers they'll ever see in a nursing fundamental exam. My goal is to have you pass your first exam, which is the most difficult exam to pass. So long as you know Chapter 2 and 3, I will emphasize Chapter 2 and 3, you will pass your first exam. My goal for you is to be successful in your fundamentals exam. Then you'll go on and do your NCLEX examination. I wish you lots of luck. I have had 16 years experience as a registered nurse, hospital-based bedside nursing. I've worked on medical floors. First was medical diabetes floor. Then I went on to med-surg. In med-surg, I worked orthopedic floor, I worked bariatric unit, and I worked oncology unit. I worked as an admission nurse in the emergency department of the hospital. I worked on a cardiac step-down tele unit, and I also worked in the intensive care unit. My goal is to give you as much answers as you will need to practice and to pass your exam. Keep practicing your test-taking skills. In order for me to present these videos, I'm going to ask you to, on the left side, hit your thumbs up button. That's your like button. On my right, below the video, is your subscribe button. Please subscribe to this channel, and please share. Today, Chapter 2. Chapter 2 is about promoting wellness, health and illness, theoretical base of nursing practice, foundations of nursing. My first answer here is a professional nurse affects healthcare financing. Examples of health prevention are checking your blood pressures, yearly immunizations, colonoscopy, influenza vaccines, yearly mammogram, TB testing, hepatitis B vaccines, shingles vaccines, pneumonia vaccines. Examples of health promotion: patient is discharged home, teach your patients how to monitor glucose, how to administer insulin injections, teach patients nutrition, low sodium, low carbohydrate, renal diet. We'll teach them how to do their wound care, how to notify the doctor if they are having any issues home. They'll call their physician. Next, we have the purpose of utilization review. In the hospital is to review admissions, treatments, and diagnosis. Care management is a multidisciplinary care model used to move clients from admission to discharge. In restorative care, the patient is transferred from the hospital to rehab. The patient receives physical therapy, occupational therapy, speech therapy for patients who are having difficulty swallowing. A critical pathway is a document used to coordinate care. Examples in post-op patients coming back from surgery. Respite care is an adult daycare. They may live at home with their adult children, they may go to work, don't want to leave mommy and daddy home. They'll take them to respite care. That's your adult daycare. Some adults, they live at home by themselves and they will go there also to socialize. Nursing practice is evidence-based practice. The quasi-experimental research is often conducted in clinical settings to examine the effect of nursing interventions. Scientific knowledge is evidence-based knowledge. Examples, searching the internet. Traditional knowledge is part of nursing, passing down from one generation to the other. Examples are making beds on a daily basis, changing linens on a daily basis. That's traditional knowledge. Philosophy is a study of wisdom, fundamental knowledge, and process used to develop and construct one's perception of life. The nurse uses personal experience to develop a therapeutic relationship with her client. A nurse uses spiritual training when counseling a patient. Example, a hospice patient. Healthcare reform brings changes to promote wellness and moving from acute illness. In-service educations are rendered in the hospitals on a yearly basis through the care method delivery model in nursing is a nurse assigned to one total care patient. Example of care method delivery model is in the ICU, one nurse to one patient. A nurse recognizes that a patient is a person. The whole system is always greater than its part. The whole system is always greater than its part. This means the nurse uses general system therapy to describe the role of nursing to provide health promotion and patient teaching. The nurse's role in healthcare reform is more education. Example, an advanced practice nurse. Focus is on holistic care, promotes health, and prevents illness. A nursing registry are agencies that provide private duty nurses to hospitals. These nurses also can work on contracts for hospitals. Visiting nurses provides visiting services in the patient's home. Durable medical equipments are delivered by companies to provide care in the patient's home. Durable medical equipment companies. Home health care nurses provide care in patients' homes. Caregiver role strain is physical, emotional, social, functional burdens which can jeopardize caregivers' health. Healthcare for seriously ill patients are hospice and palliative care. Evidence-based practice for nursing process is the use of information from research and other sources to determine safe and effective nursing care. Randomized controlled trial in nursing is the highest level of experimental research. There are 3 stages of illness. The first stage is denial. The second stage is acceptance. And the third stage is recovery and rehabilitation. Institute of Medicine transforms the future of nursing. National Priorities Partnerships goal includes family and patient engagement, population health, safety, care coordination, and palliative care. Managed care focuses on financial risk and cutting costs down. National Priorities Partnership are 28 healthcare organizations collaborate to transform healthcare. Healthcare regulation and competition controls healthcare costs. Hospitals have accreditation and certification to demonstrate quality and safety and evaluates performance. Entitlement reform is legislation making changes in entitlements, benefits such as Medicare and Medicaid. Utilization Review Committee eliminates overuse of diagnostics and treatment services for patients on Medicare. Prescriptive therapy. Prescriptive theory in nursing is addressing common nursing interventions used in facilities to explain how they can perform more effectively and efficiently. Patient Protection and Affordable Care Act provides Medicaid and subsidized coverage. Health insurance marketplace help people to find health insurance that fits their budget. Health services pyramid manages health instead of illness. Emphasis is on wellness, contributes to improvement in healthcare. Healthcare big picture. Healthcare big picture is to access healthcare quality, safely, and affordability. Vulnerable problems are people with disability, chronic conditions, mental illness, substance abuse, cultural, racial, ethnic minority, poor, homeless, and poverty. These are vulnerable problems. In care coordination, this process is patient shifting from one setting to another to control responsibility of all healthcare professionals. The aim of care coordination is to link patients with resources in the community to enhance well-being. Primary care providers are typically patients' first point of contact when they have medical concerns or needs. When your primary care physician refers you to a specialist, you are in secondary care. You will now be taken care by a doctor who provides specific expertise. The tertiary care provider, these are your inpatient hospitals. Patients are transferred from secondary to tertiary care for advanced professional care. A lobbyist is an advocate in healthcare promotion who takes part in organized attempt to influence legislation. A clinical decision maker is a nurse who uses critical thinking in decision making. Roles and functions of nurses are as a client advocate, a counselor, a researcher, a clinical specialist, a nurse practitioner, a nurse anesthetist, a nurse educator, and administrator. Please leave comments and tips below. Let me know how we can advance these videos. I will try to answer all comments as soon as possible. Please send me as many tips. I will be looking forward to them. Please press your like button below this video. Please press your red button if you'd like me to continue giving you all the answers to all the chapters in your fundamentals exam. You will be notified as soon as I upload videos. Please share this video. Please read ahead. For Thursday, we will be doing Chapter 3, Community-Based Healthcare, Challenges in Healthcare, Home Healthcare. Thank you for listening today. Have a blessed day. Thank you. I'll see you on Thursday at 10 a.m. Eastern Standard Time.